Good evening. My name is Bruzzese, and today I'll be presenting a novel approach to exploring the virtual reality exposure therapy literature with the NCPTSD repository, a comparative review of the clinical trial literature. I completed this review with my mentor, Dr. Lisa Ann Gugurillo. To understand the research that we conducted, it's important to be familiarized with post-traumatic stress disorder. PTSD is a psychiatric disorder affecting roughly 8 million people in any given year, and 7 to 8% of the population suffer from it at some point in their lives. It develops when a person experiences or witnesses a life-threatening and traumatic event, including a terrorist attack, a natural disaster, or physical or sexual violence. If a person suffers from traumatic stress symptoms for more than 1 month, they may be suffering from PTSD. According to the National and International Practice Guidelines for treating PTSD, trauma-focused psychotherapy is the most effective treatment approach for PTSD, over and above medication-based treatments. Trauma-focused psychotherapy focuses on the memory and the meaning of traumatic events. Patients will process their traumatic experiences by visualizing, speaking, or thinking about their traumatic memories. The treatment is usually delivered via a one-on-one format in 8 to 16 weekly sessions, and examples are prolonged exposure, eye movement desensitization and reprocessing, and cognitive processing therapy. Meta-analytic studies suggest that 53 of 100 patients who receive a course of these treatments will no longer meet diagnostic criteria for PTSD. CPT is a 12-session psychotherapy that teaches patients to reframe negative thoughts about their trauma. Conversations with providers and short writing assignments give patients a new understanding of the event that reduce negative effects on their current life. EMDR is a psychotherapy that helps patients process and make sense of their trauma. Patients will focus on thoughts, feelings, and bodily sensations present during the remembrance of the trauma, and it will help them cope with uncomfortable feelings related to the trauma. PE is a 12-session psychotherapy that teaches patients to gain control of their trauma by facing their fears. Exposure to the trauma and experiences avoided daily decrease fear and re-engage them in everyday life. Despite promising findings, over 40% of patients suffering from PTSD who engage in these treatments do not have remission of diagnosis. One treatment modality with clinical promise is virtual reality exposure therapy. VRET's mechanism of change is also rooted in exposure, but patients in VRET utilize VR technology to recreate a simulation similar to their trauma experience. This technology may be a head-mounted display device or computer-automated room, giving patients visual prompts to engage in their memory of the trauma, and it may help them feel safer and learn how to control negative responses if encountering it in real life. This image shows an illustration of VRET to combat PTSD in veterans and other service members. During the process, patients undergo computer-generated VR that is designed to increase their emotional connection to the memory of the events. It's a gradual exposure that may resemble those in the figure above. Advantages of VRET include an immersive experience, economic replicability, and more flexibility than some traditional treatments. VR technology shows promise in one day being completed from the comfort of someone's home and used by more psychologists in day-by-day practice. VR has gained popularity in everyday culture as part of video games and other computer programs. It makes it less daunting and more familiar for patients. VRT may lessen negative stigmas related to PTSD treatment and become more approachable to patients. Lastly, VRT includes a collaborative effort of software developers, engineers, educators, psychologists, clinical users, and more specialists. Software developers, engineers make the machines used in this treatment, and researchers and psychologists complete VRT research and help patients suffering from PTSD. The National Center for PTSD Repository is a database that combines data from over 400 published studies and a wide range of treatments and is updated annually to capture new studies. The PTSD repository contains data from randomized controlled trials conducted in adults, and the studies relate to PTSD treatment with studies targeting PTSD outcomes. For the methodology of our review, the main objective was to group related study variables into datasets. For the purpose of this project, we utilized the psychotherapy treatment category on an arm level to specific treatment conditions. Data were organized by treatment focus of PTSD and/or PTSD plus a study filter. Data was organized into TF or non-TF with study classes including VRET and CBT. Most importantly, the state of literature of VRT was studied in a comparison to other cognitive behavioral therapies, and the results identified areas of growth for VRT trials, adding focus on the PTSD outcome comparisons between treatment arms in relation to VRT and other such treatments. In the PTSD repository, almost half of the studies included have been psychotherapy trials, and of these TFs, PE has been studied the most, making up 16% of the TF treatment studies. CPT had 14%, EMDR with 10%, and VRET does not have the literature base to be parsed out on its own, and thus is part of the other treatment section, making up 31% of the treatment examined in the database. This image shows an illustration of the study intervention for RCTs in the NC-PTSD repository. Around 400 of these studies were in TF and non-TF psychotherapies. Pharmaceutical subclasses given to some patients were antidepressants or anti-anxiety medication. Complementary subclasses included yoga, relaxation, or clinical hypnosis. Most participants underwent 50-minute to 120-minute sessions weekly. This graph identifies TF by comparing 5 first-line treatment intervention groups. Most study arms were given in person and individually. In this figure, the study interventions for VRET were broken down to analyze specific intervention groups and the usage percent of each per RCT. All the studies were completed in 2019 and 2020 with risk of bias levels ranging from low to high. Treatment duration ranged from 2 to 18 sessions, and patients included in the study were active duty military members with community, mixed, and veteran status. Both male and female members were studied. This image shows an illustration of the comparison of the number of RCTs utilizing VRET, examining trauma centered around combat-related and terrorism, political violence, or forced displacement. Of the 11 studies reviewed, most treated patients with combat-related trauma rather than terrorism, political violence, or forced displacement. In the systematic review of the PTSD RCT literature in the NC-PTSD repository, the researchers investigated the current state of literature of the VRET PTSD RCTs, including what populations have been studied and adaptations of treatment protocol. Current research on PTSD treatment is being investigated to determine the most efficacious treatments for patients. TF treatments have been successful, but seeing as VRT is a newer treatment, there's limited research on its efficacy. So, further research is needed to understand the limitations of VRT, and the training of mental health providers in VRT must increase so that these such limitations may be eliminated. One future implication would be to complete a review of VRT treating PTSD patients without veteran status to understand the current promise of it in treating a wider population of people with PTSD. My second future implication will be to complete my own research on VRT to treat PTSD, and I would do this in college or beyond. Here are my references. Any questions?